All right. So what's next? The challenge that we have, as you could see with our second panel that we're going to have, session number 2, is that our colleagues from Ukraine are currently under the drone attacks from and from the Russian Federation and Kiev and other cities. And so basically they are not available to present, which is unfortunate because that causes, it's unfortunate because that's even happening. But what that means for us is that we are going to take a rather long break now. So we're going to take a break and then we will reconvene at 12:30. So we are just about to get started. And so we are going to start with Roman, who's going to be presenting all the way from South Africa. Roman, welcome.
Thanks, Kyle.
Stop sharing here.
Okay, let me see if I can share my screen. Good evening from South Africa, or good afternoon to the United States. Thank you very much to TIEMS for allowing us to present some of the work that we do on the bottom, at the southernmost tip of the African continent. The work that I'm going to be presenting on is part of some of this research and theoretical work that we've been doing on disaster risk management and emergency management in South Africa, and it came out of the work of one of my students, Emma Chapman, who works on accountability and disaster risk management in Southern Africa. And when we started looking at the original idea of the project was to look at accountability at a very small, not a small level, but at the level of a very small local municipality in the western part of South Africa. But the more we started looking into it, the more we started realizing that the accountability framework that we originally thought all the stakeholders in the disaster risk management system at a local level have legislated functions. And if everything works well, they've got the resources and the technical expertise, everything works fine. But then we realized the more we were looking into it that actually and especially COVID exposed this, is that the disasters that you see manifest, for example, as an outbreak of a disease, does not come out of nowhere, which is not a new idea, but it is also a manifestation of not necessarily just a disaster, but also an overlap of what we now think is a crisis, and then an emergency and a disaster. So what I'm going to try and do today is outline some of the theoretical framework that we're trying to develop, and then I'm going to try and provide some examples about how we got to it and what is the way forward in this ongoing research. So when you look at the crises, emergencies, and disasters that we face across the world, you can pretty much make your pick. There is the war in Ukraine, which is unfortunately prohibited some of our panelists from joining us earlier. And also a crisis at the political level. Many countries we see that are dealing with challenges on the economic front and also challenges of COVID, such as distribution of vaccines, have many times been delayed by lack of political will. Now, at the same time, political conflicts or misunderstandings, should we say, between individuals, very small group of people, can be short-term. They can result in a strife, which is not necessarily a larger problem, but it can snowball into one. In addition to that, traditionally, we would see an emergency as a set of conditions that can be defined, for example, a car accident or an unfortunate maybe building collapse. But we more or less know what kind of injuries to expect, what kind of negative outcomes on human health to expect, and we can prepare. So we can devise standard approaches to resolve the emergency. In context of political crises, what we would normally see is that there are not necessarily legislated mechanisms, but there are political traditions and more or less functionings of a society that is, for example, democratic, which can be used to resolve such conflicts. In emergencies, you would have standardized protocols, for example, triage and similar to that you can use to resolve the situation. You are not necessarily going to save, unfortunately, everybody from dying, but you're going to be able to limit the impact of emergencies on a very small number of people. On the other hand, when you look at disasters traditionally, and COVID has exposed this on a scale which we haven't seen in a really long time, which is the global scale, and that is that the functioning of a whole society or socio-ecological system, which means humans, animals, and environment, is generally completely redrawn. Now, are these three the questions that we started asking ourselves when we started looking into the impacts of COVID into the small municipality in the Western Cape province of South Africa? We realized that there is actually elements of how the COVID has unfolded at the local level that can be elements of that situation or the pandemic could be characterized as crises. Some of them could be emergencies and some of them could be disasters. So we looked at some examples of recent examples of situations that could have elements of all three types of situations. And then from there, we started looking at developing a theoretical model. Now, during the recent part of the study, Emma looked at what is the literature out there that links crises, disasters, and emergencies. And we found this paper from Al-Dahash, which will be then further unpacked in the full paper that I will get to shortly. And we looked at crises, disasters, and emergencies. Al-Dahash 6 years ago published a review where they looked at elements and properties or ways that you can distinguish or say that crisis is this, disaster is this, and emergency is so on. So if we look at the picture here on the top left-hand corner, you see crises. On the top right-hand corner, you see disaster. And at the bottom of the triangle, you see emergencies. And in between them, there are various characteristics that each one of them has more or less of, and that more or less allows you to distinguish where the crisis starts and where the emergency starts and where the disaster starts and where they overlap. So as you can see with crisis, for example, there are no single solutions. It draws on public and media attention because generally crises, for example, in the political sphere, like we saw recently in the United Kingdom, they are short-term, but they are quite important in the public discourse and in the public domain. So they do capture quite a lot of media attention. Now, on the other hand, there are normal procedures that can be directly deployed and applied when you encounter an emergency, for example, a car crash, and you can immediately call for action, but these things do not necessarily make international or national news, but they can make local news. They are fairly standard, easy to classify, and generally quite easy to deal with. On the other hand, disasters on the top right-hand corner are concentrated in time and space. They are highly unpredictable when it comes to data, as we saw, for example, during the COVID by infodemic of conspiracy theories such as 5G and so on, which are completely devoid of any connection to reality. But at the same time, the disasters require multi-agency, which means multiple stakeholders to respond to them. So if we look at this distinction in the theoretical level, what does that mean for the practical implications? Do recent examples from South Africa and around the world indicate that there are more crises than emergencies or than disasters? So I'm going to look at three examples in the next couple slides. So the first one is the drought in South Africa. Now, this is a lack of precipitation, which has been quite common in the southern part of the African continent for a long time. Now, what does it mean? There is a general lack of precipitation, for example, due to things like the El Nino effect. The lack of precipitation can then be prolonged over several years, leading to potential onset of long-term droughts or aridification, where, for example, currently where I'm sitting in the southern part in the Eastern Cape province, we've had a drought now for 7 years. Now, there are mitigation measures that have been put in place. For example, the decreased water levels or water availability can be mitigated in an agricultural area or in the area which is impacted by agricultural drought, where production of crops and staple foods might be negatively impacted. You can decrease the impact of the drought by, for example, treating and irrigating wastewater. On the other hand, you can put mitigation measures, which was the case during COVID-19, where the drought occurred at the same time as the pandemic, yet hygiene and personal hygiene and washing hands was a key non-pharmaceutical intervention to prevent the disease. You can deploy water tankers and storage tanks at the household level or in public areas which are close to the houses. And this way, you can provide availability of drinking water. At the same time, policy response and national drought can be activated at the disaster management level. But a local problem often originates from the fact that public service, public good, or delivery of public good, the water, drinking water, is often a problem. And this is complicated by various things. For example, lack of political will to build sufficient infrastructure over decades. The democratic government, there has been major improvements in the infrastructure for drinking water provision, but the supply is now still not matching the demand. That is due to the fact that in recent years we have seen decrease in finishing of projects and also dilapidation of aging infrastructure, which predates the onset of the democratic government. So in other words, the drought is compounded by the pandemic, by political infighting, corruption, and also many times lack of technical skills. So one can ask, is this a crisis? Is it an emergency? Or is it a disaster? Now, we would argue, based on our research, that it has a combination of all three of them, because political infighting and political inaction often result to infrastructure not being kept up, not being developed further, and thus demand and drought impacts become very profound, and they can escalate from a political crisis into an emergency where you, for example, see outbreaks of infectious or diarrheal diseases on a small scale, into a disaster where long-term drought can impact or decrease the availability of water to the residents. Second example is the explosion in the Beirut port, which occurred in 2014. Now, the background is quite well known, but the main aspects are that a nitrate fertilizer was stored insufficiently or unsafely, and eventually, after since 2014, the nitrate was stored, and then later, around 2021, it exploded, which resulted in the destruction of large parts of the Beirut port and also the surrounding inhabited areas. Basically, what seems to be emerging is that a political crisis in the country of Lebanon and lack of accountability for storing and disposing or handling the nitrate properly resulted in an explosion, which was completely preventable. But because it occurred during the time when the country was going through a debilitating economic crisis and there was lack of political action, it has resulted in a collapse of the economy even further and much hardship on the population, which means that the rates of poverty have gone up, and a political crisis, which has been lingering in the country for decades, has resulted in an emergency where the explosion itself resulted in large casualties, and often because of the economic shortfalls in the country, the healthcare system was unable to cope. This then led to a political crisis through an emergency, potentially cascading into a disaster, which has long-term impacts on the country and which still seems to permeate through the Lebanon's existence today. Now, then the last one is the war in Ukraine, or war on Ukraine rather, where political tensions have been simmering in the region between Ukraine and Russia pretty much since the end of the Cold War and the collapse of the Soviet Union, and specifically since 1994 and the early 90s when Ukraine became independent, and in spite of giving up all its nuclear weapons, which was at the time, I believe, the third largest arsenal in the world, it was still in a state of limbo where periodically there were outbreaks of political strife between pro-Russian and pro-European or pro-Western parts of the political spectrum. These have often turned violent, and then in 2014, and then finally in 2022, this has resulted in an occupation and invasion, and ultimately in a devastating war that currently is carried out on Ukraine by its neighbor, Russia. Now, in the political domain, the crisis transformed into a set of emergencies where deaths and injuries from rocket fire, fires, and other destructions, such as, for example, the pictures we saw a couple of months ago about pedestrians being run over by tanks in the streets of Ukrainian cities, have unfortunately unfolded into a disaster due to the fact that a large parts of the housing stock were destroyed. People have become homeless and displaced. Many people have become refugees pretty much all around the world. And at the same time, what seems to linger is also the impact of the war worldwide, specifically in Africa and the Middle East, where lack of shipments of grain, which is a staple food in many countries, for example, in Algeria and other parts of North Africa, but also, for example, the knock-on effect of decreased availability of edible oil, which drives up prices. This has major impacts on not just Ukraine and Russia, but also on the wider region and basically on the entire world. Now, in this context, we are facing a potential catastrophic level event where in recent weeks, there have been threats of deployment of tactical nuclear warheads or nuclear weapons from the Russian side, which would have devastating impacts on the entire planet. Which means, again, we see crisis elements, emergency situation elements, and also elements of a disaster. So how do we deal with it? Now, COVID-19 has been, in this case, a blessing and a curse. It has unfolded concurrently to pre-existing disasters, crises, and emergencies. But at the same time, if countries reacted well, it provided an opportunity for realignment of resources and a state of affairs in political systems of countries. And if countries seize the opportunity, major changes could be implemented that could potentially improve healthcare provision and sourcing of vital resources for disaster response, boosting of healthcare capacity, and so on. Now, COVID-19 is thus an example of, or one of the latest manifestation of a state of what we call utilitarian qubit, where humanity currently finds itself inside the continuum of crises, emergencies, and disasters that unfold all at the same time. And it is often impossible to see where the pain of humans and where the pleasure or the joy of life can actually be separated. Both pain and pleasure are part of the human existence, and they have been forever. But the recent disasters, emergencies, and crises that I have described and that we are currently studying have pretty much wiped the distinction or the ability of humans to distinguish about where does the pain end and pleasure begin, and vice versa. Existing vulnerabilities and inequalities have been accentuated by the COVID-19 and concurrent disasters. They have also, for example, the vaccine access and distribution of the vaccines across the globe, impacts of lockdowns that were geographically very specific, depending on whether people were in the global north or developed countries, for example, the G20, and global south or developing countries. There is definitely a need to understand that COVID and the concurrent disasters have exposed the fact that the uncertainty and complexity of the disaster and emergency management landscape has increased, and it is necessary to rethink and remove the barriers between political, emergency, and disaster risk management system, because COVID and the other disasters clearly indicate that they are becoming one. Complex solutions will require that we resolve these issues at the national and international level, because crises, emergencies, and disasters as a continuum will continuously indicate that will continuously keep impacting the entire humanity. And this is the paper that I've talked about. It will be shared after the conference. And then these are my references that I have used in the presentation today, along with my co-authors. And I would like to acknowledge the International Emergency Management Society that provided funding for Emma's scholarship to facilitate her TQAC certification and also her master's studies. Then I would like to thank University of Žilina, where one of my co-authors is situated, Professor Istway, for providing some literature resources to completion of the study. And then I would like to thank you for your time and attention, and I'm happy to answer any questions you might have.
Roman, thank you very much for your presentation, and we will see you later this afternoon.
Thank you.
Thanks, everybody.